the last lecture, we covered about what the mental health is and the different aspects, how we can see a person is mentally healthy or not, and how to cope with certain situations like teacher-student scenario, parent and child scenario, then spouse scenario. Uh, in this lecture, I'm going to present particularly about the most common psychiatric and psychological disorders in pretty good detail. We will talk about a little bit introduction of these psychological and psychiatric disorders. Then we will talk about the clinical features or the diagnosis, and then we will move to their treatment options available. So let's begin. So my mind and me, we don't get along sometimes. This is uh, song lyrics from Selena Gomez, and she was, suffering from mental health issues and SLE. She wrote about all of it in a song and then posted on YouTube in the form of a documentary. Let's see that video a little bit. I have added like 30 seconds of that video.
I hope you are unable sound out on your end, Dr. Jamil. We can see the video, but there is no audio from the clip. Apparently, that Jamil doesn't hear this comment. But again, ladies and gentlemen, this is the first example being introduced by Dr. Jamil, our presenter, as he is talking to us about clinical psychology and the most common causes of both psychological and psychiatric problems. Dr. Jamil, can you hear me?
Yes, yes, I can hear
Okay.
you.
Okay. Are you also producing sound on your end? No?
Actually, this was a little segment of like 30 seconds about the mental health issues a famous singer, experienced, and she wrote a song about it. So I was, referring to those lyrics about that in
Okay.
that 30-second video.
Okay.
Okay, moving to the next introduction to the mental health. So we will see what a mental health is, what is its significance, common myths and misconceptions, and why do we care about mental health so much. So understanding mental health, if we speak about mental health, it covers almost all of our emotional, psychological and social well-being. It affects our thinking, feeling and actions and plays a vital role in every stage of life, from childhood to the adulthood. Mental health is really very important. Socially it is very important, because we need a sound mental, we need a sound mind to interact with the people, to keep going with the healthy relationship, to cope up with the everyday issues. So the significance is, the importance of the mental health can't be overstated, as it impacts daily living, relationships, and physical health. A healthy mental state allows individuals to realize their full potential, work productively, and contribute positively to their community. So a sound body has a sound mind, and a sound mind has a sound body. If a person is, physically sick, he or she might definitely suffer from a little bit of, highs and lows in his or her mental health. So if a person is, suffering from the mental health issues, then there will be ongoing definite side effects on the physical health as well. For example, if a person is suffering from anxiety, so he might have sick stomach, or might be having, IBS, or might be having phobias, or uh, might be acting a little bit erratic or impulsive. So these all are interconnected. Our physical health and mental health both are interconnected in many different ways. So both of them, are closely interrelated. If one of them goes wrong and other one definitely goes wrong. So common myths and misconceptions are dispelling most common myths such as associating mental health disorders with the weakness or viewing them as rare occurrences. So one of the major myths is that a person suffering from mental health is a weak person, or he or she is on some sort of drug, or a disabled person, or whatever. There are different point of views about those persons, but that person is just a person who is struggling with his mental health issues. There's nothing wrong with that person, as himself or herself. The only issue is he or she is suffering is the mental health. If we get that treated, the person is all right and good to go. Why we care about mental health, emphasizing the universal nature of mental health and how it is not just relevant for those with diagnosed disorders. Everyone can benefit from understanding, promoting, and maintaining mental health. Mental health isn't just about getting diagnosed and treated if a person is having mental health issues. It is also about understanding about it, how these circumstances are, or how the these processes work, or promoting these mental health awareness and maintaining mental health. This is even if a person himself or herself is not suffering, there is a friend or a family member or a very close one might be suffering. So it is very helpful if a person knows, understands these issues very well, so he or she can can help the other one, the affected one. So the World Mental Health Day is celebrated on the 10th of October every year, and it is almost celebrated in every country to raise awareness about the psychiatric and psychological issues which are increasing in number these days. So the difference between psychological and psychiatric disorders is psychological disorders are mostly connected to our emotions and behavior patterns, while the psychiatric issues are 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 mainly and proven to be linked with some sort of our body directly, like biologically there is something going wrong with our body, and it is manifested as psychiatric disorders. There might be a possible overlap. So psychological disorders concerned with the behavioral patterns in emotional distress, often diagnosed by psychologists through assessments and interviews. So in psychologists, especially clinical psychologists, treat these kind of disorders in the form of therapy sessions and interviews. Treatment may be include various forms of psychotherapy, behavioral modification, stress management techniques. So in psychological disorders, a clinical psychologist treats the patients mainly by non-pharmacological techniques. Uh, in other words, I would say like he or she uses psychotherapy, behavioral modification, and stress management techniques to help patients overcome their psychological disorders. Moving to the psychiatric disorders, they are diagnosed and treated by medical doctors called psychiatrists. These disorders have biological or physiological basis. Their diagnosis may involve lab tests, physical exams, and medical history review. Treatment includes medication, psychotherapy, or a combination, and may require ongoing medical management. So, psychiatric disorders are mostly linked directly to the body, biologically or physiologically, because there is definitely something uh, going on which is wrong in the brain. For example, there are molecules in the brain called neurotransmitters. If the balance of those neurotransmitters may get upset, they may manifest as psychiatric disorder. So the treatment options uh, mostly include psychotherapy and pharmacotherapy both. In the psychotherapy, the patient attends different type of group sessions or family sessions with the psychiatrist, or solo session with the psychiatrist, and the psychiatrist also prescribes some medications for his or her or their mental health issues. There are a lot of medicines available now for the treatment of anxiety, depression, schizophrenia, and other different type of disorders. So mostly the psychiatric disorders are treated effectively by combination of both psychotherapy and the medications. However, there is sometimes overlap of both conditions. A person is having psychological disorders and psychiatric issues at the same time. So in such conditions such as depression or anxiety may be classified as both psychological and psychiatric issues, depending on the severity, underlying causes, and the professional making the diagnosis. So if the issue is solely psychological disorder, the affected person doesn't need any medication to treat that. He or she should, will attend some sessions, undergo some stress management techniques and behavior modification. He is good to go. Then the psychiatric disorders in which we, do psychotherapy, we do medication, or we do combination, or we, keep an ongoing medical management for, we keep patients on follow-up and we assess the patients regularly. So in the overlap conditions like depression or anxiety, multiple techniques or multiple interventions are deployed, in which both psychological sessions and psychiatric manipulations are done to treat those kind of patients. So this is the pie chart in which depression is a major issue. 40% of the patients mostly go through the depression. It is a major one amongst the mental health issues. Then comes the anxiety disorders, then drug use disorders, alcohol use disorders, schizophrenia, bipolar disorder, pervasive development disorders, childhood behavior disorders, other mental health disorders. So the depression is the leading one in the mental health issues, followed by anxiety, and then drug use disorders. So drug use disorders are more like disorders of dependence on legal or illegal drugs. We will see them one by one in the next slide. The next one is anxiety disorder. We're gonna discuss it in a very good detail. Anxiety disorders are characterized by excessive fear, and anxiety may include generalized anxiety disorder, panic disorder, social anxiety disorder, and sexual specific phobia. So anxiety disorders are mostly linked to the excessive fear and panic state. If a person is stressed about exams, stressed about something, stressed about an interview or anything in particular, that stress is not anxiety. That is called optimum stress, which is totally normal. That is totally normal if a body experiences stress in certain situations. Like if a person is being chased by dogs, that stress is totally normal. That is called optimum stress. That is not anxiety. Anxiety is when you think about like if you are afraid of something, even if you think about it, your heartbeat starts rising and your hands start shivering and you start sweating. That is called anxiety. That is not optimum stress. If you think about anything and you start, you start going crazy, like your hands are shivering, you are sweating, and your, heartbeat goes on rising and rising. That is called anxiety. So diagnosis relies on structural clinical interviews, self-reporting measures, and observations. There are different type of questionnaires available on internet that assesses the anxiety scale of the patient. There is it is also assessed by the clinical interview. If a person sees psychiatrist in person, so he or she asks them specific questions to rule out whether a person is, suffering from anxiety or from optimum stress, and it's or whether it's nothing. So treatment options may include cognitive behavioral therapy (CBT). It is also called psychotherapy, in which patient attends regular therapeutic sessions with the doctor. Next one is selective serotonin reuptake inhibitors (SSRIs). It is a group of antidepressant medications or specific group of medications that are used to treat anxiety disorders or depressive disorders. So the serotonin is a neurotransmitter in our brain that like boosts our mood and makes us feel satisfied or happy. If the balance of these hormone serotonin goes wrong, then there is definitely some manifestations in the form of disease such as anxiety or depression. So these drugs help to maintain the serotonin levels in the brain, so the person goes on with his normal life routine activity, or if he or she feels normal. Then relaxation techniques are also offered to help those persons and the lifestyle changes, like to avoid the company or in which the person feels more anxious, and or there are different ways that can be deployed to treat that anxiety disorder. One of them is psychotherapy, or called CBT, cognitive behavioral therapy. SSRI is a group of medications, relaxation techniques, and lifestyle changes. So, what exactly anxiety is? If we have a feared situation, anxious thoughts trigger. So, a person might be having physical symptoms, part of flight or fight response. Our sympathetic system gets on. We may get dry throat, sweating, butterflies in the stomach. That is called also a symptom of anxiety, heart pounding, dizziness, and shallow breathing. So, uh, the person, goes in uh, two phases or more. Is he or she like starts overthinking about situations, like I feel awful, feeling triggered thoughts, something bad is about to happen. So these all thoughts go on in circle, and further trigger this situation more and more. Uh, so this person is stressing about more or less about nothing. Uh, there might or there might not be any danger in real life, but if the person is not having any sort of issues or stress about anything, but still he feels anxious about things, like that's not normal, that's called anxiety. They should definitely see a doctor, and the doctor will definitely get them a personalized treatment based on their situation. Either they will go for the CBT, they will go for the SSRI, or different techniques or lifestyle changes. The next one is mood disorder. Mood disorders, including depression and bipolar disorder, involve fluctuations in a person's mood, which may influence overall well-being and daily functioning. So, in the previous one, we saw about that anxiety a person may have in different forms, but the mood disorders are a bit different, and this type of disorders mainly affect only the mood of the person. Either the person is going into a major depressive episode, or the person is bipolar. Bipolar disorder means a person is totally fine and happy. In the next second he goes, he gets angry about something. Or the the mood shift is very quick in the bipolar disorder. So this is depression and bipolar are the examples of mood disorder. So diagnosis evaluation includes medical history, physical exam, lab tests, and psychological assessment. So all of these, are assessed to make a proper diagnosis. Either the person is having mood disorder, or having anxiety, or other sort of symptoms, or other any issue. So treatment may include medications, psychotherapy, lifestyle changes, or electroconvulsive therapy (ECT) in severe cases. ACT is more like stimulating the brain, like to leads, like if any of you have done or been through the ECT process, there are sort of different leads they place on your body. So in the ECT, there are different type of leads that are placed on the brain, and they stimulate your areas which are least functioning, or causing the depressive episodes in the serious patients only. In mild cases, ECT is not usually recommended. So how we can find if we have a bipolar disorder, or major depressive disorder, or we are just feeling low due to any reason? So is it more than a bad day? Feeling low, major depressive disorder, and bipolar disorder, they all can be interrelated in different ways. So if we talk about feeling low, and bipolar disorder, these conjunct in the feeling of sadness, may be tearful, can be in response to upsetting or painful circumstance. That can be totally normal, unless until it goes too long. So, in major depressive disorder, feeling of sadness goes for long, for weeks, and for months. May be tearful, can be response to an upsetting or painful circumstances. So, even if the circumstances be corrected, but the depressed person still feels that low mood like for months. So in bipolar disorder, symptoms last for a longer period and has a significant impact in person's life. Episodes of great highs or irritability and episodes of depression or psychosis. So in bipolar disorder, there are two major shifts in the person's mood. Either the person is feeling very high, a very happy and in a good mood, and in the other instance, the person is totally angry or irritable or being in a totally manic state or being depressed state. So these are called bipolar disorder and the major depressive disorder. Both of them make mood disorders and can be treated by psychotherapy, lifestyle changes, and ECT. So these all disorders in the previous slide and the upcoming slide, these all are the different type of disorders. Anyone can experience that. So it is very essential if we identify these sort of issues so we can properly get it treated in the right time. Next one, we have schizophrenia. It is a chronic disorder affecting thought patterns, feelings, and behavior, often characterized by hallucinations and delusions. Schizophrenia is a sort of severe form of mental health issue in which a person is having, hallucinations or delusions. Uh, this person may or may not be, totally isolated from the reality. He or she might be talking to themselves without anyone talking to them. They are responding out of nowhere to, like if someone else is present with them, but there is nobody, but they're still talking to, like having a proper conversation. That is called hallucination or delusion. Diagnosis involves psychiatric evaluation, medical history, and careful observation over time. So the treatment typically consists of antipsychotic medications, psychotherapy, social and vocational skills training, and support from the loved one. So the treatment for the schizophrenia is quite comprehensive, and it's a very long-term treatment for this issue, in which antipsychotic medications are deployed, psychotherapy is going on, social and vocational training is going on with the patient, and a whole support from the family is required to help the patient to recover from that situation. So schizophrenia symptoms are different. Three types of we have symptoms: uh, positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms mean things that are present but that shouldn't be. That are called hallucination and delusion. What does it mean? It means the there isn't anything or any person is standing next to the patient or any animal or nothing is even there. The patient, your patient is standing in the empty room, but he or she might still seeing something which is not present. That is called hallucination. So this is called the positive symptoms. Negative symptoms include things that should be present but are not. Difficulty expressing emotions and planning, lack of motivation, isolating, disinterest in day-to-day life. So negative symptoms mean the person that uh, the things he or she should do, but they are not doing it on the regular basis. Like they are not expressing emotions, they are mostly quiet unless they are having the episode of hallucination. They are totally uninterested in everything. They isolate themselves. They are completely detached from the real life, from the daily daily routine things, everything. So positive symptoms means there aren't anything uh, next to the patient, but the patient still sees it. It is called positive symptom of schizophrenia. Most people, confuse schizophrenia with the paranormal activities, but it is if the other symptoms are also present and the history suggests that schizophrenia, it should be definitely it should be treated at the right time. But if the disease course goes long, it gets very difficult to treat it. The next one is obsessive compulsive disorder, OCD. OCD is characterized by persistent unwanted thoughts, obsessions, and the behavior that are called compulsions. In diagnosis involves physical exam, psychological evaluation, and detailed history taking. In every psychiatric disorder, these three components are really very important. The OCD cycle in which these three or four components are mostly present, in which a person gets obsessive thoughts, he gets anxiety about it. His compulsive behavior makes him to do that thing about which he was thinking obsessively. So that gives him temporary relief. Then that relief fades, and then another impulsive or obsessive thought comes in. Then the person gets anxiety due to that thought. That under anxiety, that person does that work or does that shows that compulsive behavior. That again he gets a temporary relief. This cycle goes on and on. So treatment may involve psychotherapy such as CBT, cognitive behavioral therapy, medications like SSRI, selective serotonin reuptake inhibitors, or a combination of both. So this was OCD. Next, we have personality disorders. Personality disorders such as borderline, antisocial, and narcissistic personality disorders involve enduring patterns of behavior, cognition, and inner experience. So personality disorders is a range of different types of disorders in which they affect totally the personality of person as a whole. So diagnosis is required the careful psychological evaluation, observation of the patient, and consideration of the individual's long-term patterns. The personality disorders aren't something that we can diagnose like on observation within a few minutes or on a psychological evaluation. It can be only be diagnosed well if someone from the patient's family or his spouse or their children tells the whole pattern of the person for like uh, a long history is required to diagnose personality disorders. Treatment may include psychotherapy and medication tailored to specific disorders. So psychotherapy is always indicated in almost all of the personality disorders, but medications are tailored to the specific disorders. Like for each disorder, there are a different group of medications available. So in personality disorders, there are I already told that a spectrum of different types of issues that goes on with the patient. Like if a person is antisocial, the whole pattern of that person is like he's antisocial for a year. Like obsessive compulsive, if a person is having OCD, that person is showing constantly a prolonged behavior of OCD, like from months or years. Dependent, a person shows too much emotional dependency, not for a few days if something goes wrong emotionally, but for months and years, that person is emotionally dependent, and that dependence is too much like uh, that's not normal. Avoidant, depressive, stonic, narcissistic, paranoid. These all are the issues that can be present in the personality disorders. But personality disorders aren't short term. They are really really long term disorders. That person is having these disorders from years, from even having from the childhood or from the adolescence, and he or she can carry it for their for their whole life undiagnosed. So it is very important to get these issues treated if because these kind of issues are really important to treat, not just for ourselves, for the sake of our family, our spouse, our friends, because there are some things about these issues that definitely bother the people around us. We may or may not be aware, but they get definitely bothered by some of the symptoms of these kind of personality disorders. So the next disorder is neurodevelopmental disorders. Neurodevelopmental disorders are most likely the disorders that you know uh, start featuring from the early years of the development, like autism and ADHD. They are mostly diagnosed in the children in the early ages, appear early in the development, and feature developmental deficits that produce impairment of personal, social, academic, or occupational function. So in autism and ADHD, the patients are definitely a bit lagging in the social skills, uh, in their personal skills, in their cognitive skills, and they are like, very slow learners. Those kids are very they show very poor progress in the academic and occupational function. They really they really take a lot of time to learn something new, or to even implement things. For example, if I would say a kid with autism, I would say like put this thing in that cabin, that kid will think about picking up for like minutes, and then he picks it up and then goes. And so whether having have second thoughts about whether I should put it in or put it on the side, on whether side. So autism and ADHD definitely leaves children mostly in a lot of issues like personal, social, academic, or occupational functioning. So they definitely get social anxiety as well, because in the competitive environments, those kids definitely get fear stress from the others of their same age, like because they are very slow learners and they do not have that competent personal, social, or academic skills. So diagnosis may involve developmental monitoring, like the kid is monitored on the regular, like monthly basis or yearly basis. Specific screening is carried out, that kids might having autism might be separated and be sent for the therapy, or for for proper treatment until they get better, to for their until they get confident enough to grow right like a normal child. Comprehensive evaluation and collaboration between medical, psychological, and educational professionals should be carried out. It is a multidisciplinary approach between the educationist, psychologists, and the medical doctors to treat this kind of issues like autism and ADHD. It is very important to get it treated, because if a child left untreated with the autism or ADHD, these things go with that child like forever. He will be lagging, or she will be lagging in these personal, social, academic, or occupational skills forever. He or she will be, a slow learner forever. Like it would be very difficult to get it treated in the later stages of life, then it should be treated at the early stages. It can be easily cured at the early years of life. Instead, it can be treated like it's very difficult, because the pattern develops in that person, because that person, gets used to it. So it would be better if that disease should be treated in the early years of life. So treatment typically includes early intervention services, school-based services, medications, and a family support. So it's also a multidisciplinary approach to treat this kind of condition. So let's delve a bit into neurodevelopmental disorders. Heterogeneous conditions characterized by developmental deficits in a variety of domains: social, cognition, motor, and language. Autism spectrum disorder, intellectual disability, global developmental delay, ADHD, social communication disorder. So these are different type of neurodevelopmental disorders that can be seen in different, children that are lagging, that is having neurodevelopmental disorders. So in this kind of in this list, any any of it can be present. So it is very important to get it in the early years of life, and because it will get imprinted, or the pattern will be saved on that person's personality forever. Next one is trauma-related disorder. Trauma-related disorders such as PTSD involve exposure to traumatic or stressful events, and that if a person holds that memory for long, and does not try to let it go, so that memory or that trauma related episode haunts him or her, that person forever. Because in PTSD, the patient definitely gets affected with a proper mental disorder, in which the person have following symptoms, maybe intrusive avoidance, has heightened arousal, either having difficulty in sleep, or changes in thoughts and feelings and daily life activities. So the PTSD is a real thing, and it is really important to get it sorted in time. If any of you may have seen traumatic or stressful event, you should talk about it to your friend, to your family, your spouse, or to psychologist to let it out. So it wouldn't bother you up in the later years of life, like in the form of a memory or a haunted traumatic event. So diagnosis includes mental health interviews, physical examination, consideration of the individual's history and the symptoms. So the patient's history and the symptoms and the interviews are really important in the evaluation of PTSD disorders, because there might be one or more than one disorder in the person's recent or the late history that is significant one. But the patient didn't do any catharsis or let it out and holding to themselves, so that thing becomes a load to their mind forever. So the treatment often involves cognitive therapy, behavioral therapy, medication, and support. So in most of these patients, only therapy sessions are enough, but solo therapy session or group sessions are also very trending, to discuss about PTSD events. So most major symptoms of PTSD are intrusive, repetitive, unwanted memories. The person is constantly having flashbacks about that traumatic event, like for years, after months. So avoidance, resisting conversations about that event. He or she, that major barrier between the person, treatment is the person is not willing to talk about it, not willing to talk about that specific issue that is bothering him or her or them. So that person is, having number one, having flashbacks. Number two is, avoiding to talk about it. Number three is, having trouble sleep, or like being wake for hours, like not being able to sleep or rest, or being agitated, like for all the time, changes in thoughts, feeling lot of loss of interest in one's enjoyed activities. This is one of the major symptoms of the PTSD, in which the person gets, uh, uh, he or she might suffer from the loss of interest in once he or she was interested in so much. Like if a person is, loves gardening, and keeps putting new plants, and keeps their garden so clean, and if we go through some PTSD events, then the person loses their interest in that garden. Things once they love, they will lose interest in them due to some PTSD. So it is very important to to get rid of those traumatic events, to talk about it, and to try to relax yourself, and try to do things that you love. But it may get sometimes difficult, because if in case if you lost someone that was you know really who was really close to you, that yes, the PTSD really goes for long, but you have to live through it. You have to live with that pain, and but do not let that pain get too heavy on your mind, that you know uh, you should get sick yourself, or you lose interest in your daily life activities. So this is all about was PTSD. Next one is eating disorders. In eating disorders, we will mainly talk about anorexia and bulimia. Anorexia is also called anorexia nervosa and bulimia nervosa. It involves the preoccupation with the food, body weight, and the shape, leading to dangerous eating behavior. So it is binge eating. If you heard about it, it is major eating disorder these days, and people usually take it so lightly. But the diagnosis should be made, and people should get it treated if they are having any sort of eating disorder. So eating disorder includes psychological evaluation, dietary reviews, like they to evaluate their whatever they are having in the diet, how their physical examination should be carried out, like for their BMI should be checked, and their history of cardio or regular physical activity should be noted, and the lab test should be carried out, like if they are having hypothyroidism or hyperthyroidism. They can also suffer from eating disorder. Thyroid is a gland like that lie here in our front of the neck that produces hormone that regulates our metabolism. If the person that hormone is producing in the low amount, that person's metabolism is low and he or she gets easily overweight. If that person's gland is producing too much hormone, that person's metabolism is way too high, and that person should be look lean or might be eating more, like might be having more appetite. So, complete psychological, medical, and physical examination should be carried out to, evaluate the eating disorder. Treatment involves the medical care, monitoring, nutritional counseling, individual, group, and family psychological counseling, and the medication. So nowadays, these a peer pressure of maintaining a shape, a body, body weight and shape. These are causing a tremendous amount of stress to the people, like to get in shape, like to get lean. That is people have set standards, like if you're not lean, you're not beautiful. So these it is not a personal opinion, but these kind of standards are set by different sides of social media. So the people get definitely affected mentally and try to uh, undergo that trend as well. Like if they are having binge eating, either they are not eating at all or they eating too much. So it is very important to counsel them for their medical care, and family or friends group therapy is also important. Like to it, it is very helpful if the person attends group therapy or a counseling session with their family or their friends. Like the psychologist jo, will definitely help their friends and the family to help that affected person. So it is very important to cope up with the eating disorders medically. It is not a joke that a person is binge eating or being too much obsessed with their weight loss or weight gain. So should be checked. The potential sign of eating disorders might include excessive exercise, like being sedentary for a few days and excessive exercise, then get back again to the sedentary lifestyle. So these are called binge, abrupt changes in their lifestyle, in their eating habits. These kind of persons might also be having electrolyte imbalance that can be checked on by serum electrolyte blood test. Uh, that person might also be having social anxiety due to gaining weight or losing weight. Usually, people might be eating too much or might be eating too low. So this was all about eating disorder. I hope that makes sense. Next one is substance use disorders. In this kind of disorders, the person is unable to control that substance. First, in the first stage, that person gets dependent. For example, there are some drugs that people use for treatment of depression or anxiety. But if the person is choosing that drug unnecessarily or illegally, that drug might cause dependence on the drug in that normal person. And if the person gets dependent, then the next stage will be tolerance. If the person is taking like 50 mg of a tablet, like for a few weeks, then that tablet will not be satisfying him anymore because that person becomes tolerant to that drug. Then he will move to a bit higher dosage. Like he would start having 100 mg of that drug to satisfy himself. Like the feeling after he or she uh, after having the drug have they so that person starts, jumping from lower dose to higher to higher to satisfy themselves. Like it is a complete and next level of dependence that a person gets tolerant. The next stage is addiction, recurrent and uncontrolled. So dependence is the very first step. The person repeatedly uses that thing illegally and uh, unchecked, because if a person doesn't need like a few drugs or medication, he or she shouldn't take it in the first place. They shouldn't take too much alcohol or do not smoke too much. Then the person gets dependent on that. dependent. The next stage comes to tolerance because that previous amount he or she was taking was is not sufficient enough to satisfy them. So they jump a bit higher dose. So that this is called tolerance. In the next step, addiction. They start taking having that drug or alcohol or any other legal or illegal substance in higher amounts, like having in hundred of mgs, like uncontrolled and recurrent, and having multiple time of the day. That is very next level addiction of that substance. So it is very important to to get it checked and properly treated for that thing, because this uh, addiction definitely gets a person in a horrible medical state, because if they start, even if they quit on their own, they will have withdrawal symptoms. That's why they will definitely be needing like medical or psychiatric support or psychological sessions to cope up with that kind of situation. So substance use disorder include alcohol and drug addiction, involve a pattern of behaviors where individuals continue to use a substance despite significant substance related problems. Diagnosis includes physical examination, history, often collaboration with a family member. So one thing I missed in this, lab tests are also very important. So because uh, different kind of drugs, either legal or illegal, can be titrated in the blood levels as well. So blood tests are also very important to get it diagnosed. Like for the amount of levels in the blood can also tell you that the person is like having how much drug in his regular routine. So because there are drugs whose half-life is like for a day. So if a person having the drug on the regular basis, so the level of that drug in the blood remains sufficiently high throughout his routine. So treatment includes detoxification, that is the very first step, behavioral counseling, rehabilitation programs, support groups, medications, and regular follow-up. Nowadays, proper rehab centers are well equipped, where all of these programs are offered, like detoxification and behavioral counseling is the very first step to make the person willing to get help from medical professionals. Then goes rehabilitation programs in which person gets get used to get used to it without taking the drug, and sports program, then medication and regular follow-up. So this is a really multidisciplinary approach in which a person should, comply with the strict uh, timeline of detoxification with the counseling and the medication. So in order to, get over that specific substance, because the drug addiction is really very important uh, thing to deal with these days. So these were the three stages of substance use disorder. I hope that makes sense. Next one is disorders with the children and adolescents, and the last one will be disorders in the older adults. First one, we will see 10% of the children and young people aged 5 to 16 years have clinically diagnosable mental health problem, yet 70% of children and adolescents who experience mental health problems have not had appropriate interventions at sufficiently early age. Because 5 to 16 year of age, because as we move like 5 to 10 years, that child is rapidly growing. Then 10 to 16, that age is the age of adolescence, the age of puberty, in which hormonal changes are going on. Uh, Different teenagers onto those hormones in different ways. So they are definitely highly susceptible to mental health issues as well. So only a few of them gets diagnosed with a proper, and get proper treatment. Like 70% of children, adolescents doesn't get diagnosed and doesn't get any proper intervention for that. So childhood mental health disorders include conditions like anxiety disorders, uh, ADHD, autism, mood disorder, and eating disorders often requiring unique consideration and treatment approaches. So there is one thing else. Body dysmorphia, also a very prominent thing in the adolescents, like in the early age of puberty. Like some boys or girls undergo this body dysmorphia stage, in which their secondary sex organs are growing, and they maybe either they like themselves or they dislike their changes in their body. So there is a that period is a transitional phase in their early teenager life. They have to go through it. So a proper counseling is very important to help them navigate through these years of life, like uh, uh, to not uh, go in body dysmorphia just because you're having hormonal changes, and counsel them that this is totally normal, and you will grow into like a proper grown man or human, and you will yeah, like have it through this is totally your biological or anatomical normal body. So this at this level, counseling is really very important to help them navigate through these years. So treatment options may include family therapy, individual therapy, school interventions, and medications when appropriate. Usually medications are not required. Mostly family therapy, individual therapy, or school interventions. Different awareness seminars or webinars at the school level are conducted to help the students like on this kind of sensitive topics like puberty, sex education, and other different options. So the next one is disorders in older adults. Mental health in older adults may involve unique challenges, including cognitive decline, because the brain functioning definitely starts declining. The number of neurons in the brain starts declining, so the cognitive function definitely start declining exponentially, and it can be accompanied by other disorders such as Alzheimer's disease, etc. Mood disorders, anxiety disorders, and adjustment to significant life changes. So, being old is like facing different kind of changes. Person loses physical strength as well. So this one is a major uh, reason they can definitely go in depressive episode. They are not strong enough. They do not eat much, or they do not physically walk or run much, or might be having that much memory they used to have. They start forgetting things. That this all of it, like it is so irritating even to think about it. So uh, if we place ourselves in that situation, so it would be very difficult to navigate through that older age for the older age adults. So there are different kind of mental health issues that older adults can face. So it is very important to get them evaluated and to help them and to support them through this process. So diagnosis includes tailored evaluations, memory tests, and consideration of the individual's medical conditions and medications. So an extensive evaluation is carried out, like memory tests are carried out, blood tests are carried out, even brain imaging are carried out to rule out Alzheimer and other type of neurodegenerative diseases. So the person can be helped, like if they are totally normal, so they can be helped to better adjusted to this kind of situation. They will be counseled, like if they are totally normal, but they are not having like any sort of disease. It is just the aging process that is making them weak, that is making them lose memory. So uh, counseling is really very crucial step to help them at this stage. Next one is treatment. Treatment may involve therapy tailored to the older population. So older population is also called geriatrics, Geriatrics. So a whole extensive research going on that particular age group, and treatments are definitely tailored for the that special needs and the special age group of that population. Support groups, medication, and family involvement is very important to help the person with it. So the five key factors that affect the mental health and well-being of older people are discrimination. They definitely feel discrimination a bit, like if person is 70, or he is not physical well, and he's like if he is or she is bedridden, another person of 70 of age neighbor is like going on the daily walk. So this creates a desperate situation between that bedridden person or that sedentary person and that other guy of the same age, like sort of it is this a very helplessness situation, or we cannot help that uh, person to be, young again, but we can definitely counsel that person to navigate through that specific issues of his life, or specific issues they are facing with, like specific needs they are having at that age. Participation in meaningful activities, relationships, physical health, and poverty. These all are the factors that affect mental health of older people really, to higher extent, because family and relationships and physical health, these are really important at this age, like, cope up with a certain situations, to live a peaceful and, life of comfort. So if a person is, achieving, having, participating in meaningful activities, having healthy relationships, and do not have poverty or have enough financial resources to live through, have good financial, have good physical health, and do not face any sort of discrimination. So these factors prolong their life and, help them uh, to have a better mental health. Conclusion, it takes a village. I would say that sentence, to help a person that is suffering from the mental health. It definitely takes a village, because that person will be needing a strong will to help themselves, their family, and spouse, children, to support them, psychologists to support them, a psychiatrist support them. So it is a multidisciplinary approach to help a person who is mentally challenged, because collective effort definitely helps that person. Like if a person is already on medication, psychotherapy helps. The positive support and encouraging behavior from the family and friends definitely helps. So it takes a village to help that mentally challenged person. The collective effort, treating psychiatric and psychological disorders is not a quality endeavor. It requires a collective effort from the healthcare professionals, families, friends, community, and society at large. Those struggling with mental health disorders are not bad or flawed people. They are individuals in the need of understanding, empathy, and appropriate care. That person, if having, having bipolar disorder, and, having bouts of anxiety, depressive episodes, or having episodes of too much happiness at once, and being angry at the next second. So that is not something wrong with person himself. That is disease that is causing him to do so, like to make him feel this way, to make him to behave this way. So it is very important to understand and to have empathy for that person, to help him or her or them, or to help your family, friends, or children, or spouse. Holistic approach treatment often goes beyond medication and therapy. It includes fostering an environment of acceptance, providing access to resources, promoting education, engaging the community in supportive roles, acknowledging the human aspect of psychiatric and psychological disorders, recognizing that behind every disorder is a person with hopes, dreams, feelings, and a desire to lead a fulfilling life. Call to action, encouraging everyone to participate in this village, whether through personal support, advocacy, education, or simply cultivating a compassionate and non-judgmental view towards mental health. So overall, if any of if any person, if any of your friend, if any of your family member, if any of your child, if any of your like your parent or your spouse is suffering from any of disorders I have mentioned in this presentation, you should definitely talk to him or her or them to get it evaluated, treated in the very first place, to to avoid complications in the further way. So this mental health, this kind of issues with the mental health are really serious, and they should definitely be treated. Thank you. Any questions, please? If you can.
Thank you very much, Dr. Muhammad Usama Jamil. That was very, very awesome. Your presentation on this clinical psychology related topic of the landscape of mental health. We've heard a lot, we've understood a lot, and of course, we are certainly ready for a good bit more, so to speak. Thank you very much. Your presentation was really outstanding. We have had multiple questions on the chat screen. Unfortunately, we have sort of run out of time. By 7 minutes, we are beyond the time initially scheduled for this presentation. We're gonna take a few questions anyway. But one thing that I would like to convey to you right at this time before we take a few questions is whether it could be possible for you to share your presentation with our beloved participants. They have raised that issue constantly, and I could not come up with a reply or an answer. So if this is any possible, please just put a link to that presentation so that our participants can just grab it and have a better understanding of everything you've said so far. We are ready now, ladies and gentlemen, for a few questions. As I said again, that's going to be just a few of them. We don't have too much time left. Lumbayi, Lunga, we're going to start with you.
Hello, doctor. How are you?
Yes, can hear you very well.
Yes. My question is because I think that Dr. G, because his presentation was so wonderful. So my question just like I want to know about ADHD and autism. So which one is more affecting the children in the childhood? Which one is affecting more in that?
So basically, both of them are different diseases. ADHD and autism are, almost their incidence is almost equal. So the patients with the autism are, have difficulty to understand and to respond to that different type of stimuli differently. So they have kind of slow learning in academics and occupational skills. But in the ADHD, that person is compromised in his attention mainly. His cognitive abilities are not impaired. So if I would say that autism is a bit more serious than the ADHD, that both of them can be easily treated as well if they are evaluated in the early stages. ADHD, if from the childhood, or the autism from the childhood, if they go for too long, for the like for 10 years or 20 years, it would definitely get difficult to treat. But if a child is get evaluated and diagnosed with either autism or ADHD in early years, they can be treated like quickly or easily. I hope that.
Oh yeah, thank you so much.
Columbus and Galizi. Columbus.
Thank you very much.
You're welcome.
One thing we have to understand that why we are having so many why we are having so many people who are having psychological.
Please, ladies and gentlemen, if you are not speaking, if you're not asking a question, that's not your turn. I would very highly appreciate that you turn your microphone off. Go ahead, please, Columbus.
The other thing we have to know is that why we are having so many people is that who have psychological and psychiatric disorder is that these diseases are too much associated with stigma, which stems up from the place where they are coming from. And so we need really to do something about the stigma too much so that people can seek treatment. Because people live in their villages because they cannot come, because the moment they seek treatment, people will get to know and they discriminate them. And in the end, we shall get so many people who are sick. Then the other thing is, which I have not heard from Dr. Usama, was what are the preventive measures that they have done so that we can learn from them and use it in the different places where we are to help people seek treatment, because once you seek treatment, you get better. I know that's one. The other thing is as a scholar, what is it that you think that is so innovative that could help people to get out of this problem? Thank you very much. Those are my questions.
Okay, if I speak of discrimination and other social issues, that is, that are considerably, bigger or somehow, being highlighted these days, and effectively, people are taking stand against this kind of issues. So if if we do not have any kind of mental health issue, we should stick to more positive side of life. We should be more empathic, we should be more kind to people, and if we are facing any kind of discrimination, we should uh, take either stand against it, that kind of discrimination. But there are also lawsuits available that we can utilize to encounter that specific group that is causing that discrimination. And depending on the other issues, their mental health issues, there are a lot of reasons. Social media is one of, I think it is one of the reasons that people get different type of mental health issues, like different phobias, like social anxiety about their appearance, like people set different standards from that Instagram or other social media and try to implement that standard in their real life. But some of them or most of them are not possible, because it is not a movie, this is real life. So it would be a whole much better if we should stick to real life. We should be more empathetic. We should be more patient toward each other. We should be more kind, and we should be least discriminating and least judgmental about others. And we should, let other people do whatever they are doing, whatever they like to do, unless until they are, harming others in their way. So this is the only way we can, avoid so many social issues and so many mental toll that it imposes on us. Thank you.
Karen, Pauline, are you ready, Karen?
Yes, I'm ready. Yes, I'm ready. Thank you so much.
You're very welcome.
I've got two questions. The first question, when it comes to, let's say, depression and anxiety disorders, most of the time, most of the cases, one of the diagnoses is because there's an oversecretion of serotonin in the chemical component in a person's body. There will be when the diagnosis is made, that there will be an oversecretion of serotonin. So my question is, as a byproduct of that, and to bring stability within the emotions of a person, is it right to prescribe, dopamine as a byproduct, because it's a reactant to serotonin? And will that bring stability to the chemical component of an individual for less fear and less depression and for mood stability? My second question is this: when it comes to mental disorder, most of it is biologically based, where you will see that there's the impairment in the cortex or the limbic system or the hypothalamus. You can see the etiology of it in the brain structure. But what about the soul? There is the soul and the spirit of a person. The soul is the thoughts, the heart, and the emotions and everything. Are there any instruments that are able to measure the impact of pain, a person, that what happens that affect a person's soul? Because immediately a child is born, when they leave their mother's womb, it is a struggle. They go through pain. Immediately their soul gets affected and there's a fragmentation. Do we have instruments that are able to measure the soul? Because when a person goes through pain, when a person goes through suffering, when a person goes through hardship, the soul gets fragmented, and there's a potential for psychosis. But most of the time, we base our measurement of psychosis from biological etiology. Have we succeeded is there research enough to say that, okay, we do have instruments and we are succeeding in this if we can measure the soul, to say that, okay, if a soul of a person is fragmented into such capacity, these are measurements that we can implement for healing and to restore balance within the soul of a person. Are there measurements or instruments like that within psychology or psychiatry? Thank you.
Okay, referring to the first question about the high level of serotonin. So there is a balance of neurotransmitters in our brain, like different other neurotransmitters like dopamine, serotonin, and a whole lot of others. So if a person is already high in serotonin, that person is not in depression, that person goes in psychosis. That is another type of mental health disorder in which the balance gets distorted and the serotonin gets high. That leads to psychosis. The high serotonin is called serotonin syndrome. It presents like in ER mostly if the person takes too much pills of even uh, if not naturally, but if the person takes too much serotonin tablets, like medicines that causes too much serotonin in his brain, that person presents to ER with different symptoms like sweating, like confused state and or mania, or like uh, in a different mental or altered state of mind. So that person is treated symptomatically, but uh, if the person is getting better with the symptomatic treatment, there shouldn't be any intervention that antagonize the serotonin directly, because antagonists directly or indirectly definitely leave a lot of side effects. So it would be better to avoid them. If the serotonin gets high, it would be better to treat it symptomatically and to help the body get rid of it, like either by renal system or either by liver metabolization system. So it would be better to get rid of it, to treat it symptomatically. Coming to the second part of the question, that if a person goes through so much suffering that his soul is fragmented, that there is no such tool for the measurement. But if a person is too much in that in depression, like postpartum depression or other sort of depression, like if they get in too much severe state that depression is affecting them physically. So there are definitely like criteria to evaluate them, how severe their depression are. Like if I have seen a patient with depression that she was completely immobile. She was lying straight on the bed and she was even able to move her hands or limbs. So he was completely in a state of like paralysis state, in which her brain couldn't able to process his motor function as well. So that was kind of severe depression. That patient was treated, that person was given medication, that patient got psychotherapy and other interventions, and she went to rehab, like for she recovered completely. So there isn't proper any instrument or evaluation criteria, but there are different criteria that help them, doctors, to see the patient how much he or she is suffering by the help of the symptoms they are presenting with, by the signs or symptoms. So a question is mentioned in the postpartum depression, what type of lady is predisposed? Postpartum depression is very common these days, like, but there is I haven't read any research about it that any kind of race or lady is predisposed, but it is a spontaneous situation that I have read about postpartum blues. There are temporary phases about the postpartum that any female can go through for a few weeks, then she recovers. If that female goes for a long time, like for a few months, that to so much extent that she doesn't even like her baby, or she doesn't even care for her her baby properly, or she doesn't even nurse her properly, or do not breastfeed her baby properly. So that is called postpartum depression. That lady is totally uninterested in that baby after the postpartum. So definitely there are psychotherapy and other medications available that can help postpartum depression. Thank you. I hope you have the answer.
I do understand, ladies and gentlemen, that many of you are waiting to ask your questions or make your comments. We unfortunately cannot accommodate those requests as we run out of time already. But let's allow only one question, only one more question from Olasupo Ademosu. For your last question, let's try to make it quick, please. Go ahead, Olasupo.
Thank you, Dr. Vasim.
You're welcome.
I like to appreciate Muhammad Usama Jamil because he has aroused my interest in the study of philosophy, psychology rather. So I would like him to recommend which books, which textbook I can read to further enrich my understanding of what he has done today before I take my decision to study psychology. That's my own, because even though it was supposed to be an overview, but with what he has done, I got interested in the topic, and I like to go deeper into it. So,
right.
But I like. So that is my.
So
thank you very much.
Which you are interested in the book of psychology or psychiatric? Which one of them?
If both are available, I'm interested because I want to study one of them.
Thank you very much, Olasupo. Thank you, ladies and gentlemen. You've been really awesome for joining us for this really gorgeous, top-notch presentation by Professor Muhammad Usama Jamil on the topic of mental health. For your conclusion, Doctor, the floor is yours again, please. Dr. Jamil, if you want to conclude.
Okay, I would like to say that this kind of issues like mental health issues are really very, should be high priority to attend, because we mostly neglect these kind of issues and things go on like filing or like, as I gave examples in PTSD, we have suffered like few traumatic events that we do not talk about, and we let it pile up one by one, and that it ultimately leaves on our head a big toll of traumatic events that haunts us like for years, and we are not able to sleep, we are not able to do routine activities anymore. We are we are low in moods forever, like we lose interest in our daily life activities. So it is very important to to not neglect if you are having any kind of this symptoms, if any kind of sadness that longs more than a few weeks, any kind of anxiety or fear that isn't due to any apparent reason. So you should definitely get it treated. And if you are holding something in your about anything traumatic that happened to you or your loved one, you should talk about it, you should let it out before it gets your mental toll, and you suffer about it. So it would be better before that thing take over you, you should take over it to get it treated and to put in place.
Quite wonderful. On behalf of Atlantic International University, Dr. Muhammad Usama Jamil, once again, thank you very much. And I extend this expression of gratitude to each and every one of you, ladies and gentlemen, for participating. I hope you have a very blessed Tuesday. But by now, if you want to just express with your own voices, a great thank you to Dr. Jamil. Thank you again.
Thank you. Bye.
We need it in our process.
Come back again. Our students from
We
Ghana,
need the presentation in our process.